Well, the CDC is stepping in to make sure that HIV programs in Tennessee keep getting federal funding.
Earlier this year, the state rejected more than $8 million federal dollars to treat and prevent the virus across the state. Fox 13 health reporter Mandy Rock explains to us now how the change will keep the money from Washington coming in.
The Coroner here is one of several organizations in our community that offers HIV testing, prevention, and care. They've relied on federal funding for years to help them operate. But now that that money has been cut, they may be getting some help from the CDC instead.
I was already dealing with issues with mental health before being diagnosed, so that kind of triggered me into a downward spiral.
It was a trying time when Jocelyn Meeks was diagnosed with HIV in 2011. But now she's using her diagnosis as a chance to educate others about the virus.
Once I was able to come out of that and realize that, I can live with this. I've got children to live for. I want to spread awareness and education.
That's why she was devastated when she learned Tennessee was cutting back on federal HIV funding.
It was really disheartening, and it seemed like a major step backwards for all the advancements that have been made.
The decision would impact several organizations in Shelby County and across the state that offer testing, prevention, and care. But this month, the CDC said it will bypass Governor Lee's decision. It will provide $4 million through the United Way of Greater Nashville to pay for HIV-related services in Tennessee.
It is worth what we can do in our society to keep people diagnosed so that they know they have the illness. Because you see, that both protects them to get therapy and it also allows them not to transmit it to others when they know they have it.
Dr. Steve Threlkeld is an infectious disease specialist at Baptist Memorial Hospital in Memphis. He said Shelby County has some of the highest HIV and AIDS rates in the U.S. Those significant strides have been made in how the virus is treated. He says prevention is key.
Education and preventive therapy is much increasingly important today to what it used to be.
And Dr. Threlkeld said about 10 to 15% of people across the U.S. don't know they have HIV infection. That's why it's especially important to have adequate testing centers like the Coroner. In Midtown Memphis, Mandy Rock, Fox 13 News.